into a different sort of conversation, and that is sexual and gender-based violence. Here's the thing, the lockdowns that we've been seeing across the world, and of course also the curfews, to be specific, here in Kenya, have seen medical services and support for people who are either sexual and gender-based victims either cut off, support for them, or the healthcare for them seen as less important. This is what Chief Justice David Maraga had to say earlier on when it came to the numbers in Kenya and how drastically they've gotten up. He was speaking earlier on in the month of April.
There has been a significant spike in sexual offenses in many parts of the country in the last 2 weeks. These offenses constitute 35.8% of the criminal matters reported during the period. In some cases, the perpetrators, unfortunately, of such offenses are close relatives, guardians, or persons living with the victims. These are people who are supposed to take care of the young girls, and instead of taking care, they are preying on them.
That is true. Here's the thing. The UN report on sale and sexual exploitation of children shows an increase in children and new form of sexual violence during this pandemic. And Kenya has not been spared. Here's the thing. I want to share with you these numbers to paint for you a gruesome image of what we are looking at. They're coming on your screens just right now. These are numbers of gender-based violence since the year began in January. These numbers have been done by the Gender-Based Rehabilitation Center in Kenya Research. They're coming onto your screens right now. Exactly, there you go. So January, we're looking at about a total number of 289 cases. February, 275. Look at that now, folks, look at that. You can see the change between Feb and March. March numbers have skyrocketed to 363 due to the curfews that we've seen. April number 272. Gender-based violence rehabilitation in Kenya says that on an average, they deal with about 250 cases monthly. I don't share these numbers with you, ladies and gentlemen, to scare you, but rather to bring your attention to what is happening, to spark your curiosity on that family member, that neighbor, that friend within our social circles that we need to be putting into task. And helping us have this discussion is Alberta Wambua. She's the Executive Director of the Gender-Based Violence Rehabilitation Center in Kenya. She now joins us by way of Skype. Alberta, these are scary numbers, but these are faces, these are names of people, not just numbers. Paint for me an image of what has become the sad reality of many Kenyan homes, because after March or during the month of March, you can tell that spike even became worse.
Thank you for having me. Good morning. Yes, it's really a sad situation. There's been an increase, about 45% increase in gender-based violence cases in Kenya, as you rightfully mentioned, at the Gender Violence Recovery Center. And I like what you say, that it's not just about the numbers, but it's about that individual going through that experience. They're really gruesome cases. We've had an increase in intimate partner violence cases. I was just going through some of the experiences that survivors have gone through. And one lady was just beaten because she went to a neighbor, for example, to pick movie CDs. So she was beaten because the husband said she's bringing corona to the family. We've had cases, like you rightfully said, for example, people close to us. I was just reading experiences of about 4 house girls who've actually abused the boys in their houses, you know, and a lot of, even when you're talking about the online cases, for example, one boy was even looking at pornographic materials and even got the house girl pregnant. So yes, it's really, really a bad situation. We've had gang rapes, for example, women being gang raped. We've had women being waylaid on their way home as they're rushing for curfew. We've had women who've turned to strangers to be able to be housed for the night because they're not able to reach home and gotten abused in that situation.
Leila, my apologies, Alberta. Here's the thing. We tend to speak about sexual and gender-based violence when it comes to children, men and women. But another aspect, Alberta, that we never talk about is within intimate relationships. What are you seeing on the ground?
What we're seeing in the ground is a lot of physical violence. So there are different forms of gender-based violence. So there's physical violence, there's sexual violence, there's emotional violence, and a lot of times, and harmful cultural violence, child marriages, all this. Now, a lot of times you do not get one form of violence alone. So what we're experiencing now is a lot of intimate partner violence. So of course, as we are socialized, by the time the cases are coming to us, it's because they're physical violence. But you find that there was an issue of economic violence. For example, you see two men who are physically assaulted by their wives in relation to economic violence. You know, a wife lost a job, pushed the husband out of home. Another one, the husband lost the job. The wife was, you know, making him do all the housework. He's even scared of reaching out for help because he says if he leaves the house, when he gets back, he's scared that he's going to be locked out. So he had his hand, you know, cut. So we are getting a lot of this. And hardly would you get intimate partner violence with one form. So they're actually sometimes even violated, sexually violated, or even raped. You're having, for example, the emotional violence, economic violence. So it gets a bit complex, especially now that it's even survivors reaching out for that support is also really hard, because then the timings, again, we have the cessations, they're not able to reach out for the services. Others are even scared to just come for the services because then they're thinking they'll get infected at the hospitals. So it's very complex. The services sometimes are not available. You're having hospitals that are scared, frontline workers are scared to provide the treatment because of getting infected. So it really complicates. And we're having a lot of intimate partner violence not being reported because of those reasons. And we're scared that then we're going to deal with the manifestations of it, when it's really bad and again already getting late presentations.
Right. So there will definitely be lifelong implications for millions, not just in Kenya, but across the world post-COVID-19. Here's the thing, Alberta, we've seen sexual and gender-based violence numbers increase, but even at such a unique time, during a pandemic that has really brought to its knees our health system here in Kenya and across the world. From where you stand, from where you sit, is sexual gender-based violence cases considered less when it comes to healthcare?
Sadly, yes. And not just healthcare. It even starts with, the society at large. Because then, even for them to get the healthcare, by the time they reach out for the healthcare services, is because then it's a serious physical violation done on them. So they would hardly even reach out for those services. Yes, it's considered less. Even now, we're really struggling to provide those services because, one, there's a lot of tolerance at a public level, at society level, towards gender-based violence. It's something that we don't talk about. It's something that's discriminated upon. When you reach out, there's a lot of victim blaming. What are you doing out at that time? Why you dressed like that? And all these reasons. You're just complaining over nothing, being abused by your partner. He provides everything else. So that puts survivors really quiet and not reaching out. It gets harder on the health system now because then there are complexities to it now. So one, access to gender-based violence services, sometimes a lot of times attach even to sexual reproductive health and rights and sexual reproductive health services. So the access to that, because we have cessations, we have, you cannot reach out to a certain facility. It's not all facilities, for example, that are able to treat, following the right regime. So those are already challenges in itself. So every attention is diverted now, for example, to COVID.
Right.
So survivors cannot reach out. We have survivors also very scared because of not understanding. So you're thinking, I'll go to a health facility, I might get infected there.
Right. And here's the thing, Alberta.
We have frontline workers who are scared. COVID is new. So you're thinking, I don't have PPEs. How then do I treat this survivor?
Correct.
So that has really brought a lot of complexities.
And here's the thing, Alberta. I'm looking at the numbers that also we were discussing. You and your team provide about 250 survivors monthly services. But on top of that, let me even be specific. We've definitely discussed the sexual and gender part of this discussion. But there's another side, early child marriage. 15 school-going girls, some have been married, 15 of them, since COVID-19 started in March. What are you also seeing on the ground when it comes to early teenage pregnancies, numbers increasing for school-going girls during this pandemic? Because yes, we have touched on the sexual and gender part of it, but there's also this other part.
Yes, and that's the sad part, and that's part of the late presentations, that survivors are not able to reach out on time, or we're not able to give information in regards to prevention of gender-based violence. And it's really sad. In just the last 1 month, in one of our hospitals, we work in 9 hospitals. So in one of our hospitals, we received 8 cases of teenage pregnancies. So these are girls who've been defiled. Reading through the case studies, girls actually left their homes to go stay with friends, to go stay with boyfriends. Still, it's defilement. And so these are 8 girls who are pregnant. So now part of what you're talking about earlier in terms of the health systems, whereas we are supported, because then we are charitable trust, we are supported to provide services and prevention of, or prophylactic services after gender-based violence. We now have to start thinking of prenatal care, delivery and postnatal care and all the complexities around it. There are shelter issues, for example, that are even a challenge. So it brings a whole different dimension during this time. So we have all these girls who are pregnant. I know we're going to get more girls, even after the pandemic. That's what we expect. We're going to get more cases of young girls, for example, or even women coming out at that particular time after the pandemic, when then they're having the strength and they're having the space to be able to reach out for services. This is also very scary.
Right, because Alberta, here's the thing. What role at the end of the day does Judiciary have to play in making sure, and I said Judiciary, I mean the Chief Justice boss's team, David Maraga, who has definitely touched on it. We played that soundbite earlier for our viewers. What role does the Judiciary and Chief Justice Maraga's Judiciary team have to play in making sure that justice for these survivors is met? Or will the law let them down and suddenly become, turns out into the old-fashioned trend here in Kenya where cases are dragged? What role does Judiciary have to play to make sure that indeed justice is done?
I totally agree with you. Access to justice is actually a whole multi-sectoral and a whole chain to it. So it starts also with the public, for example, and the society not perpetrating the violence. It starts with timely reporting for evidence, preservation and the whole chain of evidence and getting the survivors to get the support. Right now, there's a big problem with referral mechanisms. So yes, they might struggle and maybe get the health facility. So even before COVID, we only had about 10 to 15% of survivors going through to the process of access to justice. But now it's actually even worse. So maybe the survivors, and most of them, are getting the medical treatment, but not reaching out for the access to justice. So you find that there are no enough cases. I mean, there's no case for Maraga's team, for example, to follow through, or there's no proper evidence. But even way before that, we have to have prevention mechanisms, safety for women and girls, men and boys, even by the security team, for example. We need to have the Ministry of Health providing those services. We have the State Department, for example, doing an amazing job. So I wouldn't say it's Maraga per se, but all the cases that then would come to the Chief Justice, of course, need to be dealt with. Courts need to be there. Now I know there some of the courts have specific courts for for gender-based violence cases. I know, for example, at the ODPP's office, we have prosecutors dedicated to GBV cases. So that's there. But sometimes discussing with them, a lot of challenges is either the cases are not being reported or they're not having proper evidence. So that whole referral mechanism is what we need to look at now, especially, for example, if the survivors are not able to reach us, how then do we even get rescues for them? So it's a whole chain for access to justice to happen.
Okay, all right, Alberta, I'm afraid our time is up. Before I do let you go, here is perhaps an unpopular question that you probably don't hear a lot, but you hinted about it at the very beginning of our discussion, and that is perhaps to what extent has this economic uncertainty that we are seeing contributed to the sexual and gender-based violence cases increasing?
It's really damaged. It would cost the country about 46 billion in a year, as a study done by the National Gender and Equality Commission towards gender-based violence cases. So one, it's not just the violation and the emotional stress, but it also the loss of opportunities, for example, because of the gender violence cases. So there's a lot of uncertainty, there's a lot of safety issues, safety issues and security issues. It has cost right from the teenage pregnancies we're talking about. Earlier, you're talking about nutrition, and there's a connection to all this. So this is a young mother, for example. How is she able then to, I'm thinking, I as a mother at my age is really so hard. So this teenage girl, so one, she could get, for example, obstetric fistulas, she does not have the money to bring up her child. Even the knowledge, for example, nutrition-based on how to raise that child. She may lose, for example, education, or get her education really late. Again, that's also resources to the family, and things like that. So there is a very negative impact on this. We have healthcare workers, for example, who the mental stress, you have no idea. A lot of mental frontline workers are not sleeping. Those who are working even in the gender-based violence space, the traumatic levels of it, that of course then also affects or ripple effects to the families and the people who are close to us.
So Alberta,
we have again...
Alberta, this now perhaps now being my last question is, what do you want to see at the end of the day being done?
What I'd love to see is emergency response plans properly there, multi-sectoral, having proper gender analysis done on them. Making sure, for example, we've considered the gender roles, the risks, the responsibilities, the social norms, and even having accountability, for example, for the unique capabilities of those who are in the vulnerable groups. So, for example, if it's sanitary pads, they used to be distributed by the Ministry of Education through the schools. Now there are no schools. Women and girls need these dignity packs. They need access to sexual reproductive health and rights. There's a stimulus package, making sure, for example, it reaches the vulnerable. And having a plan that is solid, that a pandemic does not come and then we're starting running our heads wondering, how do we have proper referral mechanisms? How do we have PPEs to be able to support the survivors? Something that runs through. Anytime there's an emergency, it's a plug and support. And of course, a lot of prevention mechanisms to make sure that then everyone is safe.
Beautiful.
And not undergoing violence.
Beautiful. Alberta, thank you so much for helping us put the faces, should I say, behind those numbers. They're not just numbers. These are cases that have become the sad reality in very many Kenyan homes. That is Alberta Wambua. She's the Executive Director of the Gender-Based Violence Rehabilitation Center in Kenya. She says that her and her team give services to Kenyans on an average month, 250 of them. And she says accountability is key during this time. Timely reporting and presentation of evidence is quite key. We are going to see justice being served on the victims of sexual, gender-based violence.